guys.
Hello.
Hi. My name is Cindy. I'm going to be your nurse today. Just going to shut these for some privacy. How are you guys doing? Are you comfortable?
Mm-hmm.
Yeah? And is the lighting in here okay for you?
Yes.
Okay, awesome. So I'm here to talk about your asthma and a little bit about how to use your inhaler so that you can breathe better, and if you're experiencing symptoms, the inhaler is going to help with that. So with asthma, you do have some inflammation in your airway that's creating these symptoms for you.
Is that why I need my inhaler?
Yes,
Okay.
that is why. So the inhaler is a way to get medication, and it's going to open up your airway so that that medication can get down to your lungs. Then you'll be able to breathe a little bit better.
Okay.
So
what if I don't use it? Like what?
Yeah, so if you don't use the inhaler, then your symptoms are gonna get worse.
Okay.
And it's gonna be harder to breathe. So it's also really important that we use it correctly so that all that medication gets down there to your lungs.
Can you show her how to use it correctly?
Yeah, for sure. So this is the inhaler. I'll have you hold it.
Okay.
You can open up that gray piece at the bottom, and I'll go over the steps with you. Here's a little bit of a visual that might help a little bit more.
Okay.
So the first step is to hold it to your mouth, and you're going to form a tight seal around that white piece. And then you're going to slowly breathe in through your mouth and press down on the inhaler one time. So you're going to do that simultaneously.
Okay.
And then you're going to take the inhaler out of your mouth and hold your breath while counting to 10.
Okay.
And then you're going to pucker your lips and breathe out slowly through your mouth.
Okay. Can I try it now?
Yeah.
Okay.
Show me how you would do it.
Okay.
Awesome.
Cool.
Yeah, that's
Is that
correct.
right? Yeah.
Yeah.
Okay.
How did that feel? Okay?
Yeah, I feel like I got all the medication breathed in pretty well.
Awesome. Yes. And holding your breath afterwards is important for
Okay.
that step too.
So if she doesn't get all of the medication in, is there something else we can do? Because I know that can be a little bit tricky sometimes
Yeah.
to make sure it's all getting in.
So one way that can help, or one thing that can help with that, is a spacer. Sometimes we recommend these for younger patients because it ensures that all of that medication gets in. So if you feel concerned about that, that's something that we could add in for her.
Okay.
And I'll just go over how to use that as well in case you decide that you need that. So the spacer goes in between your mouth and the inhaler, and then you're going to put it between your teeth and form a seal. You'll spray a puff into the spacer, just like you did pressing down on the button, and you'll breathe in slowly and deeply. You'll hold your breath in for 10 seconds, just the same way as you would use an inhaler, and then pucker your lips and slowly breathe out. So it's really similar to using an inhaler. It's just adding in that extra piece, which would help with the medication.
Okay, so since she's
more.
older, she probably will be fine without it. But if we think that her symptoms aren't getting better, or we just don't think that she's getting all the medication in, can I just call up here or just go get one of those, and that should help with that?
Yes.
Okay,
for
perfect.
sure. And then, do you guys have access to a pharmacy?
Yeah.
Okay.
We have health insurance too.
Okay, great. So we'll make sure we get down which pharmacy you guys like to use, and then we can send it there. And do you understand when you're supposed to be using your inhaler?
I think so. So just use it when I have flare-ups, kind of when I feel my chest getting tight.
Yes.
Or when I can't breathe very well, use it then.
Yep.
Or you're wheezing,
Or
right?
wheezing.
Correct. Yep.
Okay.
So some inhalers are daily use, but the one that you have is going to be for when you have symptoms. So when you're feeling that way, that's when you'll use it correctly. So it's important that you carry it with you in case you do end up needing it.
Okay.
Do you guys have any other questions? I'm going to be sending this handout home with you so that you have it back to look back on.
That's great.
I don't think we do. If we do, can we just call up here and let us know?
Absolutely.
Okay,
Cool. Yeah, I think I know how to use it pretty well, but I'll have her call if we have questions.
Okay, sounds great. It was
Thank
really nice
you.
to meet you guys.
You too. Thank you.
So one of the strategies that we used to address health literacy was using our handout. So we use this in the video to help educate the patient through both the images that we have on here that show exactly how to use an inhaler, and then we also have the steps listed out. So as I said the steps, the patient could also read them and have that reminder, and then we said that we would also send the patient home with this handout so that they have it to reference back to. Another strategy we used was the teach back method. So I had both the family member and the patient kind of answer questions to demonstrate their knowledge about what I taught them. And then we also had the patient demonstrate how to use an inhaler to ensure that they were using it correctly.
Yeah, like she asked me, the patient, if I knew when I was supposed to use the inhaler, so I would know when I was supposed to use it. And then obviously we demonstrated it, and she told us me that I was doing it correctly. For a different patient population, like a young child or someone who might need the spacer if they're not able to just use the inhaler alone, we would educate them like a little bit more about the spacer, and that would be who we tell, like that population, younger kids, would be more of a target population for a spacer, just because all of those steps that Katie explains kind of might be hard for a little kid to do all those, so they would benefit more from a spacer.
And then if there was like another population, I know again we talked about like the young adult population in our video because Madeline, but if someone like with a disability needed to use an inhaler, we could get some extra help from like family members and make sure that they're really understanding how to use it and that they can help the patient as best as possible, or that we could also have like a home health nurse come in each day if they have like that everyday use inhaler to help them out.